Hi, I'm Margie Boyer. I'm an OB nurse consultant with the Florida Perinatal Quality Collaborative. And today we're going to explain to you how to use the MORE folders. First of all, most of you by now should have received your folders. We mailed out over 1,000 to all of our MORE hospitals. We also sent out a brief PowerPoint if you would like to share that to your team as well. But we thought it would be nice to have a short snippet on the overview of the MORE folders, as well as a role play on how to implement the MORE folders. So today, I'm just going to start out by telling you why did we develop the folders. First of all, we heard from the Illinois Perinatal Quality Collaborative that using the folders was one of their best initiatives to really get their opioid use disorder program going. It's nice when you don't see a patient come in with opioid use disorder very often that you have a structure on what is required to care for these women comprehensively. So we took their folders and we piloted them at 4 hospitals across the state of Florida. And we do want to thank Lakeland Regional, Amanda Snyder and her team, as well as Winnie Palmer. We had Cindy Tinder and her team, and then Halifax, Jennifer Willett Butts at Halifax, and then Shanice Matthews at UF Jacksonville. We spent a couple of months actually sending them samples. They gave us feedback on the checklist as well as the folder content, and we adapted it. And we're real happy, and we hope you enjoy using these folders as well. So let's go through the contents of the MORE folders. Once a patient screens positive, utilizing that evidence-based practice tool, either the 5 Ps or the NIDA Quick Screen or the CRAFT for pediatrics, you go ahead and the patient screen positive, you get your folder out of wherever you're storing these in L&D or postpartum or antepartum or triage. Go ahead and pull that out. The first thing you're going to see when you open it up is you're going to see that pocket card for ESPERT. This is for the providers. They like to have this to carry it with them in their pocket so they know a little bit about how we're going to, the recommendations are for brief intervention, as well as interpreting the 5P screening tool. So that's a handy reference for the providers to have. Behind that, you're going to see the checklist. Again, this is the comprehensive checklist. When the patient screens positive, this is what you pull out on admission, and everything you need. This will guide you along the way as far as if you need to get some more orders from the provider. So the best thing to do is to call a huddle once the patient screens positive, if that's possible, to include the provider. Hopefully you can somehow get social work, case management involved, as well as a charge nurse. Sometimes it might be just you and the provider. The next thing you're going to see is the algorithm that was designed by our OB experts, and this helps guide the provider on what needs to be done during that delivery hospital visit. Behind that also is going to be how to prescribe Narcan for the providers, and ILPQC did share that tool with us as well. Behind that is the trauma-informed care flyer, just to ensure that we're treating all patients the same. And you may not know it, but the patient may have experienced some type of trauma. So we give you some guidelines there on how to provide that sensitive care that our patients sometimes require. Then the next thing there is going to be the behavioral health impact information. That's going to be the resource for the providers to be able to consult with an expert on opioid use disorder via a phone consult. So that's for the providers to have if they need that. Then on the right side of the folder is everything you need for the patient. And this is what you're going to hand the patient is going to be the folder with these 3 items inside. So the first thing you'll come across is going to be the how to use Narcan. That's the trifold. This is nice to give the patient, go over it with her. Hopefully she'll have a prescription or actually the kit in hand before she goes home. Then there's also a handout on family planning that she can have to discuss with her provider. And then the last thing, most comprehensive, is the More Hope pamphlet. And again, we want to thank Healthy Start Hillsborough for their help on creating this, along with the women who reviewed this, who have been through opioid use disorder during their pregnancies. as well as our obstetrician experts, our nurse experts, social workers, as well as our FPQC team, public health experts also that helped on developing this pamphlet. So everything that you need is actually inside this pamphlet. When you hand it to the patient, you do want to take the time, obviously, to go through the different sections with her. And so that's everything inside the folder that you will need when you have the patient who screens positive for opioid use disorder. And just to let you know, the other reason why we're doing the folders is because as we're getting the data back from our more hospitals, we're not doing well in a couple of areas that one of them is around Narcan education. So by providing this folder, you're going to be able to document that you provided Narcan education. Family planning is another area of growth, as well as MAT referrals. So those are areas that we really felt by utilizing this folder, we would go ahead and get better results that way. So what we're going to do is now show you a role play as well of the nurse and provider doing a huddle, and then the role play of handing that folder over to the patient.
Hi, Dr. Flores. I was wondering if right now would be an okay time that we could sit and go over the MORE initiative. I have your one patient that that definitely scored positive, so I did talk to her about this.
Okay.
So I didn't know if we could go over, if now's a good time that we can go over this with
Absolutely.
you. Wonderful. So we have this little checklist, that way we can make sure we give her and her baby the best care that we can provide.
Okay.
Hi, it's Danielle, your nurse again. So after going through the 5P screening tool that we used on you, you indicated that you had a history of a substance abuse disorder. So I just wanted to give you a little bit of information that we have here at the hospital for our moms. It's called the MORE Initiative. So in this folder, there is going to be information that your providers have, as well as information that we're going to provide you. The purpose of this is just so that you and your baby can have the best outcomes.
Perfect. During this snippet, we have reviewed the MORE folder contents and simulated a huddle scenario and a patient education scenario. We know your huddle and patient education interactions will be more extensive. Please reach out to FPQC for further assistance, and thank you for all you do for moms and babies.